Greetings, I'm Tammy Lee Demler. I'm going to be talking to you today about eye drops. I'm one of the pharmacists here at the Buffalo Psychiatric Center. There's a whole team of us that take care of all of the medication needs for the people who are in our care. And so we give out eye drops for many reasons, and I thought this would be a good topic to review because most of us have used eye drops. And in the future, many of us will continue to use eye drops. So this overview will give you some good ideas as to how to use eye drops. And I have some questions that we'll do at the end if we have time. So let's get moving here. Today we're going to talk about what type of eye drops there are. We're going to look to see how we take eye drops properly, how we use them, how do we apply them, or the word maybe instill is another verb that we can use, instill an eye drop. What are the possible side effects for eye drops? And is there anything else that I should know or expect when I'm using eye drops? So what kind of eye drops are there? You probably could guess a few, maybe not all of them. I had to actually make sure I didn't forget any of them. And one of the more common eye drops that we use would be for infection, an antibiotic eye drop. So when you have an infection in your body, you take an oral medication by mouth, and that helps get into your bloodstream, and then it gets rid of the bacteria that's causing the infection. But when you have an eye infection, generally, we can treat that with just a topical or an eye drop that just goes to the surface of the eye. So some people have an infection that's bad enough that they might need an eye drop and an oral medication. But most often we can do well with just a topical or a drop instilled in the eye, and then that treats the local bacteria. The bacteria for eye infection generally doesn't get into the bloodstream. It usually stays kind of right on that eye surface, causing redness and burning, so we're able to do that. Now I will mention to you that there's also allergic conjunctivitis. Conjunctivitis can be a description of a certain type of infection. So in conjunctivitis that's infectious can be contagious, meaning you can catch it from other people. But there's also something called allergic conjunctivitis. And conjunctivitis really just means an inflammation, an irritation, or redness of the conjunctiva, which is part of the eye. Allergic can be from pollen, it can be from things floating in the air, it can be from cats and dogs, and if you're allergic to animals, that sort of thing. So we can certainly take medications to treat that as well. I'm going to go with the antibiotic for infection first, and I just want to mention to you that antibiotics are specific to the type of infection. So not all antibiotic drops will treat all infections. Many times they can be a widespread treatment, so many infections can be treated with a similar eye drop, but eye drops generally are pretty specific to the infection, just like an oral medication would be. And again, that allergic conjunctivitis, there are some examples of the types of drops that would be azelastine, cromolyn. Those anti-allergy drops can work in different ways. Cromolyn tends to keep the inflammation cycle at bay, whereas some of the other products like azelastine can be more of an antihistamine, like a Benadryl would block the effects of histamine. And histamine is something that's released from the body in response to allergies. So the body has this reaction that's intended to get rid of the offending allergen, and sometimes that can be red eyes, itchy, watery eyes. We've all probably been there, right? So the allergy drops that we can use are many different kinds, but they work like a Benadryl if you were to sort of think of it in that sort of way. There are eye drops for inflammation. So anti-inflammatory drops. Why would your eye be inflamed? It could be injury. It could be part of the allergy cascade. There could be a number of reasons why your eye could be inflamed. Prednisone is an example of a steroid, but the kind of prednisone that is liquid is prednisolone. That's the one that we use in the eye. And some non-steroidals, like you would think of ibuprofen, we have a liquid version that's called flubiprofen, and there's other anti-inflammatory products too that don't sound so much like ibuprofen, but it works in the same sort of way. So again, reduces inflammation, helps to reduce redness, but swelling can also be part of that inflammation. So getting rid of all of those similar symptoms be very helpful, can really cause a lot of symptom relief. Eye pressure can happen for a number of reasons. So your eye, and this is a picture of the eye if you can see it, everybody's eye has a certain amount of pressure because we need that eyeball to stay intact. It's circular and it's full of liquid. So there's a very fine balance between having your eye make enough fluid and then having enough fluid lost so that there's an equilibrium, an equation that works to have the eye pressure stay the same. If your eye pressure is too low, your eyeball can collapse, and sometimes people have different types of infection, they have injury, where they need to have some intervention to make their eyeball have enough pressure because they have too little. But it's more often the opposite problem, is that you can have too much pressure, and that's called glaucoma. And your eye doctor would be the person to diagnose this. They can take measurements of the pressure in your eye. If you've ever had an eye exam where you felt that puff of air, poof, I don't like that exam, but it's necessary. They're detecting the eye pressure in your eye, which is a certain expectation. It's like blood pressure, but it's not blood pressure. But your blood pressure has a number, and you have a number that's a goal, a number that can be too high. Sometimes you can have a number that's too low. There are medications that can be used for eye pressure as well. Some examples are timolol and latanoprost. And if you have glaucoma, you know which one that you're using. And for glaucoma, I would say, very rare exceptions to this, that most people take their drops forever because that glaucoma doesn't go away for most people. It can be controlled, but it doesn't usually go away. It's not like an infection that has a limited period of time. And then we also have here, we have dilating drops. The eyes, if you can imagine, dilated eyes are when your pupils are really large. It allows more light in, and it allows examiners to be able to see the back of your eye, like your retina. If your eyes are constricted and they're real pinpoint looking, real small, you can't see too much into the eye that way. So to dilate the eyes to really allow a medical examiner to be able to see that your eyes are healthy and they can see the back of your retina. So atropine would be an example of that drop. Now here at BPC, we have atropine eye drops that sometimes we use for people who are on clozapine underneath their tongue to help with their salivation. So people who are on clozapine may have a tendency towards having a lot of saliva buildup, and so atropine under the tongue can help dry that up a bit. So atropine is a very interesting eye drop. Generally, we don't put eye drops in our mouth or anywhere else, but in this case, we can use them for another purpose. So that's kind of a fun fact. Vasoconstrictors, these are probably among the more commonly used over-the-counter medications. We call one of the most common ones Visine by brand name, although Visine now has, I think, 10 formulations available with different tweaks to it that you can add to different symptoms that you want to treat. But for the most part, we call these eyes bloodshot eyes, red eyes. If you don't sleep well or if you rub your eyes at night, sometimes you can wake up with red eyes. It's important to know that when we use those medications, though, that we can't overuse them. So if you use your eye drops for red eyes every day because you like the way that your eyes look without redness, your eyes, when you stop using that, so let's say for the next day or next days you don't use it after you've used it for many days or weeks, your eyes will come back and be even more red. It's what they call rebound eye perfusion, so a rebound redness, more so than it was when you first started. So it's really important to not overuse them. In other words, if your eyes are completely healthy and you just have red eyes because maybe you didn't get enough sleep, or maybe you wear contacts and you overuse them, you should really give your eye just a break from those eye drops because they shrink your vessels. That's why the eyes become less red. And when you shrink your vessels for a long period of time, your eyes are not getting enough oxygen. Remember, we use our blood vessels to get oxygen, so your eye blood vessels are always trying to get oxygen into your eyes. So I had to be reminded of that when I wore my contacts too much. My eyes were starving of oxygen, so I try to give my eyes as much of a break as I can. On to anesthetics. So anesthetics are medications that help to alleviate pain. So topically, an anesthetic will help dull the pain. I'm hoping I spelled that right. It doesn't look right to me, but maybe I'm just overthinking it. But anesthetics are for pain, and it can be used for procedures. If you have, injury, sometimes we can use something called tetracaine. People have in the past used different versions of what would be benzocaine, epinephrine, that kind of thing. So you may have heard some of those. And generally, we're not applying those. It's really probably the person doing a procedure or after the procedure. And then there's relief from from dry eyes, artificial tears. Those are very available over the counter generally. But we recently had a recall because a company hadn't been able to demonstrate that they were safe and effective. So many of the products that used to be available are right now in short supply. So you may have found that to be the case as well. So how do we properly use an eye drop? I think this is an important step to be thinking about, is that you always need to be following the proper storage and handling recommendations for any medication that you get. So I have a family member who likes to put things in the refrigerator because they think that keeps things fresher, but it's not the case. You need to not put something in the refrigerator that shouldn't be refrigerated because that can destroy the chemical stability of that medication. So only refrigerate things that you're told to refrigerate. Generally, eye drops are kept at room temperature. You don't want to freeze them either, so you want to make sure that they're not overly heated or overly chilled. So make sure that they're in a place where you can control the temperature. Because they're eye drops, they're formulated for the eye, and unless otherwise described to you, you shouldn't be putting them in any other location. Now, I mentioned atropine sometimes can be used under the tongue at the discretion and recommendation of your doctor if you're using clozapine, for example. But we sometimes can use eye drops in the ear for infection. So in terms of the eardrop availability, there aren't as many choices in the eardrops as there are in eye drops. So we can put an eye drop in the ear if the doctor prescribes it, but it can never go the other way. So if you have eardrops, they can never go in the eye because they're not appropriately balanced for eye use, and they're not as sterile as they would need to be for eye drops. So just remember, only follow the directions of your doctor, and make sure you're asking questions when you pick up a medication from the pharmacy. Make sure that you're hearing exactly where the pharmacist is describing your doctor said to use that medication. Follow instructions on the label. So make sure that you're reading the instructions on the label when you pick up a prescription. Read them back to the pharmacist. Make sure that you're understanding exactly how to use them. Wash your hands before you actually use them, though, because regardless of what you're using them for, we have bacteria and viruses on our hands. We know that now from COVID better than ever. So make sure that you're washing your hands. An appropriate period of time to wash your hands with soap and water would be 15 to 20 seconds. Sing happy birthday, a slow rendition of happy birthday, and get your hands nice and clean. You can use hand sanitizer as well, but just know that that's usually alcohol based, and if you're going to be at all close to your eyes, that can cause some burning. So I would say probably you could do it opposite. Maybe do hand sanitizer if you wanted to, and then wash your hands with soap and dry your hands really well. Things that are in a suspension is a certain formulation of an eye drop, need to be shaken. So if you don't shake it, it's as if you would imagine everything, all the particles of active drug would be in the bottom. And when you put that eye drop in, you're not getting as much of what you would need of the active ingredient. So give it a good shake. If in doubt, I would shake it anyways, because for the most of the conditions that we would be talking about, the medication wouldn't be disturbed by a shake. But it could be that you don't get enough if you don't shake it. So ask your pharmacist, should this be shaken? We try to put a shake well sticker on things that need to be shaken, so that's also a good clue as to how to use that. So I'm going to walk through the stages of using an eye drop and an eye ointment, which an eye ointment is a thicker version of an eye drop. You're using it probably for the same purpose that you would for the eye drop, but I'm going to walk through and then I'm going to show you a little video that doesn't have any sound that will show you the technique in a cartoon illustrated way. So again, I'm walking through. You're going to want to make sure that you're doing proper storage and handling, not sharing the medication with anybody else. It's only for you, and you're going to wash your hands. Then you're going to get into a position where you can tilt your head back and look up. So if you maybe have a lounge chair or if you're on a couch and you can rest your head comfortably back, you'll want to try to open your eye, look at the light, don't focus on the tip of the dropper, and certainly don't touch the dropper or tip to your eye. But sometimes we have to look away to be able to get that drop in our eye. A good question has come up is if you miss your eye entirely, should you do the drop again? Yes. You should do it again if you totally miss your eye because you didn't obviously receive that dose. When you're in that position, you'll pull down the lower lid of your eye with your index finger and form a pocket, and the video I will show you exactly how to do that. And then you'll hold the dropper with your free hand, holding it as close to the eye as possible without touching it. And then while looking up, and this is a little trick I would say, is maybe look to the side, away from the dropper, gently squeeze that dropper so the drop falls into the eye pocket made by the lower eyelid. Close your eye for 2 to 3 minutes if possible. Sometimes that's an awfully long time, but even a minute is good. Tilting after you have that drop in your eye, tilting your head down a little bit, placing a finger on the tear duct, maybe with a tissue so that you don't touch the eye, and then gently apply pressure. The reason for that is that the corner of your eye has enough of a duct that it can absorb medication into your systemic circulation, and that's not necessary. So to avoid that, touching and pushing the tear duct a little bit will help resolve or reduce the risk of that. And try not to blink or squeeze your eye. Again, you're going to only tilt your head down after you've had it up enough time for it to be able to absorb. So not until after the 2 to 3 minutes of having that topical effect take place. And if you're using more than one drop, which happens, sometimes we'll be prescribing more than one drop, you'll want to wait between both drops, and you don't want to instill them at the same time. Even though that seems like it would be a better use of time, you want to use one, wait, and then put the other drop in. And it's important to ask your pharmacist which drop goes first because sometimes it does matter. Now, if you're doing an ointment, it looks like a toothpaste tube, and you're going to do this similar process of washing your hands and tilting your head back, but you're going to squeeze the nozzle, and as best you can, what they call a little ribbon, about 2 to 5 centimeters above the eye, just so that the ribbon falls comfortably inside the eye sac of the lower lid, which we'll be showing you, from the nasal corner out. If you go the other way, it's not a problem, but it's easier generally to go nose and then in. And then close your eye immediately after the medication is administered. And you don't have to worry so much about tipping that eye forward. You're just going to be absorbing that eye ointment. I like to do eye ointments at night so that the almost Vaseline-like substance can stay on my eye. If you do it during the day, it can cause blurring of vision, and that's not ideal. So here we're going to watch our video, and again, I know we've done the video before and it didn't work so well, but this is going to require just my voice, and perhaps you will not be able to hear me, but in any event, just watch the video. We're going to probably just be quiet for a minute. Okay. So that was our video display. Hopefully that made it a little bit easier. The only thing I would say is that the man in the picture should have either had a pair of gloves on or used a sterile tissue, not to directly touch your eye close with your finger, because it's too easy to get bacteria and viruses in there, and that'll cause more trouble. So what are some possible side effects for eye drops? So side effects that don't really require medical attention unless they continue to be a problem, it's not just temporary, would be any kind of eye irritation or itching if it's just temporary, like just a minute or two and then it passes. If you get some blurred vision, that can be just because there's drops in the eye or ointment in the eye. But if your vision continues to be blurry, if it continues, that needs to be reported. And although we can give you a list of possible side effects, if you see anything unusual or bothersome, you can give your doctor a call about that. They can report it to the FDA, and my recommendation is have them do that because they can fill out certain paperwork if it's a very, very unusual side effect. But we wouldn't expect that to be the case with any of you listening today because the medicines we use here are very safe and are very effective here. So what are the possible side effects continued? Side effects that you would want to report to your doctor right away: allergic reactions, skin rash, itching, hives, swelling of the lips, face, or tongue, or throat, or even if you get a severe swelling of the eye, some sort of reaction that's worse than what you started out with when you were trying to seek treatment. Any eye pain, change in vision or loss of vision, or any new worsening eye pain, redness, or irritation, or discharge, things that would come from the eye that would not be the eye drop. Those are things you'd want to tell your doctor. Anything else you should expect with drops, I would say you're going to want to make sure with antibiotic drops you finish them the entire prescribed time that your doctor has ordered them, unless you have an allergic reaction, but you need to really navigate that with your doctor. So don't stop the drop until you talk to the doctor, unless you're advised otherwise by the pharmacist because the reaction is so severe. If you stop an antibiotic too soon, let's say, for example, you're feeling so much better after a few days, but your doctor has prescribed it for 10 days. 7 days, 10 days, whatever they would have prescribed. If you stop too soon, the bacteria that is currently being treated or caused to be decreased can come back, and it can be even more strong and mutate to be resistant. And I know that Dr. White talked to you about this before. You don't want to have that be the case, because then antibiotics become less effective for everybody who wants to use them. So make sure that you're using them for the entire duration that the doctors prescribe them for. You should not share them with anyone else, because again, the eye drops are specific to the infection, and you could possibly have contaminated the drops without knowing it and pass that infection along to the person who might be using them next. So don't share with anybody else. And they should be discarded after the prescribed duration, because it's not going to be good for a future infection. We all feel, I think, tempted to not waste, and that's a good thing to not waste, but in this case it's important to waste, because it's not going to be good for another future benefit. We would give you a fresh drop if you needed them again. So this is a little wrap up and review. We're going to go over some of the questions, and I'm going to see if you can answer them. And I've got a few other questions that came up during our break, so I'm going to ask you what you think about those. So what kind of drops are available? So what kind of eye drops do we talk about? Do we talk about diabetes, allergies, blood pressure, mood stabilization? What do you think would be the best choice here? You picked allergies, you're right. You might have been tempted by blood pressure, because I used that as an example with glaucoma, but remember, it's not blood pressure, it's eye pressure for glaucoma. Excellent. How do I properly use an eye drop? All right, what do you like here for these choices? Wash your hands before applying, use an old bottle for a new infection, store all eye drops in the refrigerator, tip head forward so excess drips out. Which of those do you like? All right, wash hands before applying. That would be the right answer. You might have liked tip head forward, but tipping the head forward is not to allow the excess to drip out, because remember, when you put in the eye drops, you're letting it soak into the eye for that 2 to 3 minutes with your head back. And when you tip your head forward, you're using that process to be able to block the duct. So again, with a little tissue paper, not your hand directly, to block the corner duct in the eye so that it's not absorbed into the blood vessels where it's not needed. So again, the tip forward is really for that purpose. It's not for letting excess drip out. What are possible side effects from these drops? Tingling in your toes, ringing in your ears, burning or itching eyes, or insomnia? Which of these do you like? If you picked burning or itching in your eyes, that would be the right answer. Tingling in your toes would only be possible if the drug were ingested in systemic circulation and it had that side effect. I can't even think of one that would do that, but the only way that would happen is if it went into the system and that was a side effect of a systemic exposure. Ringing in your ears, no. You could use eye drops sometimes in your ears when the doctor says to do that, but generally it would not cause ringing in the ears, tinnitus. So we're going to just go with C, burning or itching eyes is the most likely. Insomnia would not be correct. And how about this? Under anything else I should know or expect, which choice do you like? You should use drops for the entire prescribed time. You should not share your drops with anyone else. You should discard the drops after the prescribed time is over, or all of the above. Which do you like? All of the above? Good choice. You got an A++ on that. So I want to thank you for listening today to this presentation. I did have just a few quick questions that came through during the break when we were looking at the video. And one question was, if I'm picking up a prescription eye drop and it looks like it's a different bottle, what should I do? And one of the suggestions I always have is, if anything looks different, and you should look at it before you leave the pharmacy, is ask the pharmacist if this is a different brand of this medication that you should be getting. It would just be a good idea to make sure that nothing's changed, or that possibly there could have been a mistake made. So it's important to say if something looks different, change of color, that you would want to know if that was the correct thing. And that goes for your pills too. Different color pills can be just a different company, but it's always good to check. Another question is, what if your eye drops look cloudy? That could mean that they're contaminated. So any cloudy changes, if there's any pieces that are chunks that are floating, you'd want to get a new bottle. Don't use those. Should I use the new refill or use up the old one. It depends on what kind of eye drop it is. I would ask your pharmacist, what supply of eye drops when you pick them up is this? If they were to say, for example, a 60-day supply, then you know that 60 days is about the duration of time you would be using those. But for the most part, it's a 30-day supply, and unless you have a whole bunch left over, it may be better to use the fresh supply. When you get an eye drop, open it up, it's exposed to air, and in the air there's bacteria floating around, viruses. Generally, there's preservatives in the eye drops that will keep them sterile for the duration of time that you're expected to use them. But an eye drop, once opened, shouldn't be kept forever, even if it's something that's not for infection. So ask the pharmacist, depending on what you're using it for, what you should do with that old supply. If it's just a few drops, it might be better just to use the new one. Should I keep old drops just in case? I would say no. Once they are open, they're no longer sterile, and they can just harbor bacteria and viruses, so that's important to know. Should I keep it in the fridge or keep it cold? Only if we tell you to. Remember, we talked about my family member who likes to keep everything in the fridge. It interrupts and can ruin the integrity, which is the stability of that medication, and you don't want to do that. And the last question, which is an excellent question, is what if I miss a dose? Should I double it? Never double a dose unless you ask your pharmacist or doctor if that's important to do. With eye drops, it's even more important that you don't double a dose because the eye can't accommodate a huge volume of liquid. So even if you're doing one drop, let's say it says 2 drops, I would put 1 drop in, wait a bit, and then add an extra drop in there. Because if you put 2 drops in right away, it could cause your eye to tear, and then you lose and dilute that volume of medication. So 1 drop at a time. If you forgot a morning dose of something that you take every day, once a day, and it's late morning, afternoon, you could probably still take it. But if it gets to be evening or close to the next dose, I would just call that dose skipped and move on with just the next day's dose. That's generally how we would do it. But again, ask your doctor, ask your pharmacist. They are more familiar with your specific case. And with that, we're out of time. I hope you enjoyed this topic, and we'll be working on more soon. Your pharmacist will be coming down to do an activity with you. So get your questions ready, and I hope you have a great rest of the day. Take care. Be well.